In this video, we're going to talk all about subacromial impingement syndrome, what it is, and what exactly it is that we do about it. Hey, what's going on, everyone? Dr. Seth King here, owner of Limitless Physical Therapy and Performance in Rochester, Michigan. I wanted to talk a little bit about subacromial impingement. We're going to talk about what it is, and we're going to give you the best playlist of videos of exercises that we have found that help people the most in this situation. So subacromial impingement syndrome, that is a mouthful, and ironically, inside of the name is all the information about what we know about it. So subacromial refers essentially to the location of the pain or the cause of the pain being underneath or sub the acromion, which is a part of the shoulder blade. Show an image right there. Now, impingement, what it sounds like, a pinching of structures or compression or some sort of pressure on structures that are not tolerating it well. And then finally, syndrome. Syndrome, probably one of my least favorite words. However, it ultimately just means that there is a collection of symptoms that are being caused by something that's going on in the shoulder. All right. Now, this particular diagnosis we find in all sorts of people, regardless of activity level. However, we do see an increased prevalence of this with people that are overhead athletes. So I'm talking about our pitchers, our CrossFit athletes. Dr. Matt and I tend to be CrossFit enthusiasts ourselves. And I've dealt with this problem in my left shoulder plenty of times, usually because of training errors on my own and going too much, too fast, too soon, the terrible twos. We'll talk about that some other day. And this problem has many fixes, almost all of which is learning how to be stronger with your shoulder, learning how to move better, and learning how to leverage what we know about the mechanics of how the shoulder joint, the scapula, the rib cage, all these things work together to give you really good, healthy positions when you are engaging your shoulders or moving them. So believe it or not, subacromial impingement syndrome, the mouthful word, and its brother-in-law, scapular dyskinesia, which is another diagnosis that has been given, which essentially means there's some sort of impairment in the way that the coordination of muscles that control the shoulder blade when you're moving, that there's some sort of a problem there. These things are debated as, how much do they exist in patient population actually, or are we just kind of throwing some diagnoses on some things that we don't fully understand? So there's debate about this stuff. However, there's a tried and true method of dealing with these problems, and it is to build more resilient shoulders with movement. Movement is medicine, and anyone who follows Limitless knows that that's what we preach. We preach that primarily because it is a research-backed option. It's not just opinion. It's not just me messing around saying what I think is out there. We know that strength training and that movement retraining holds the best opportunity for healing some of these problems that come from overuse. Okay, so now that you know what subacromial impingement syndrome is, some of the nuances of that phrase, what I want to do for you is link you right to here or wherever this is above me. I'm not entirely sure. I'm going to give you the best playlist that I have put out there full of exercises basically that I use with my patient population to deal with subacromial impingement. These are things to get the shoulder blades moving better, to get the rotator cuff muscles doing their job to a higher capacity, and ultimately leading to less impingement and less pain in the shoulder because of this problem. Hey, I hope this was a helpful video for you. Please, please, please like it, share it with someone who needs it, subscribe below if you want more.